stroke is a medical emergency that occurs when there is an interruption in the blood supply to the brain. This can lead to brain damage and loss of function in the affected areas. Understanding the different types of stroke, risk factors, symptoms, diagnosis, treatment, and prevention is crucial for managing and reducing the impact of this serious condition. Types of stroke. There are three main types of strokes. Ischemic stroke. This is the most common type, accounting for about 87% of all strokes. It occurs when the blood vessel supplying blood to the brain is obstructed. Ischemic strokes can be further divided into thrombotic stroke, caused by a blood clot thrombus that forms in one of the arteries supplying blood to the brain. It often occurs in arteries damaged by atherosclerosis, hardening of the arteries. Embolic stroke occurs when a blood clot or other debris forms away from the brain, commonly in the heart, and travels through the bloodstream to lodge in narrower brain arteries. Hemorrhagic stroke. This type occurs when a blood vessel in the brain ruptures, leading to bleeding in or around the brain. It can be caused by aneurysms, weak spots in blood vessel walls that can bulge and rupture. Arteriovenous malformations, AVMs, abnormal tangles of blood vessels that can rupture. Transient ischemic tachycardia, often referred to as a mini stroke. It occurs when there is a temporary decrease in blood flow to the brain, typically lasting a few minutes to a few hours. While TIAs do not cause permanent damage, they are significant warning signs of a future stroke. Risk factors. Several risk factors can increase the likelihood of having a stroke, including high blood pressure, hypertension, the leading risk factor for stroke. Heart disease, conditions such as atrial fibrillation, heart failure, and prior heart attacks. Diabetes increases the risk of stroke and contributes to other risk factors. High cholesterol. Elevated levels of cholesterol can lead to atherosclerosis. Smoking. Tobacco use is a significant risk factor for both ischemic and hemorrhagic strokes. Obesity. Excess weight contributes to hypertension, diabetes, and heart disease. Physical inactivity. Lack of exercise increases the risk of various stroke-related factors. Excessive alcohol use. Heavy drinking can raise blood pressure and increase the risk of stroke. Age. The risk increases with age, especially after age 55. Family history. The family history of stroke or cardiovascular disease can increase risk. Ethnicity. Certain populations, including African Americans and Hispanics, are at higher risk. Symptoms. The symptoms of a stroke can vary depending on the type and location of the stroke, but generally include sudden numbness or weakness in the face, arms, or leg, especially on one side of the body. Sudden confusion or trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden difficulty walking, dizziness, or loss of balance or coordination. Severe headache with no known cause, often described as the worst headache ever. Diagnosis. To diagnose a stroke, healthcare providers may perform several tests. Medical history and physical examination. A thorough assessment of symptoms, medical history, and a physical exam to evaluate neurological function. Imaging tests. CT scan, computed tomography, used to determine if a stroke is ischemic or hemorrhagic by showing brain tissue and blood vessels. MRI, magnetic resonance imaging, provides detailed images of the brain and can identify areas of damage or bleeding. Blood tests. To check for risk factors such as blood glucose levels, cholesterol levels, and clotting disorders. Carotid ultrasound. This test uses sound waves to examine the blood flow in the carotid arteries in the neck, identifying any narrowing or blockages. Cerebral angiography. A specialized imaging test to visualize blood vessels in the brain and check for blockages or abnormalities. Treatment. Treatment for stroke depends on the type and severity of the stroke. Ischemic stroke. Clot-busting medications. Intravenous tissue plasminogen activator (tPA) is used to dissolve blood clots. It must be administered within a specific time window, typically within 3 to 4.5 hours from the onset of symptoms. Mechanical thrombectomy, the minimally invasive procedure to remove large clots from blood vessels, usually performed within 6 to 24 hours after symptom onset. Hemorrhagic stroke. Control of bleeding. Medications may be used to control blood pressure or prevent seizures. Surgery. In some cases, surgery may be necessary to repair blood vessels, remove blood, or relieve pressure on the brain. Rehabilitation. After initial treatment, rehabilitation may include physical therapy, occupational therapy, and speech therapy to help regain lost skills and independence. Prevention. Preventing strokes involves managing risk factors and adopting the healthy lifestyle. Control blood pressure. Regular monitoring and management of blood pressure through lifestyle changes and medication if necessary. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and low in saturated fats and sodium can help reduce stroke risk. Regular exercise. Aim for at least 150 minutes of moderate intensity exercise each week. Quit smoking. Seek resources and support to quit smoking and avoid exposure to secondhand smoke. Limit alcohol consumption. Drink alcohol in moderation, if at all. Manage chronic conditions. Proper management of diabetes, high cholesterol, and other health conditions can reduce stroke risk. Stay informed. Knowing the signs of stroke and acting quickly can save lives. The acronym FAST can help remember the warning signs. Face drooping, arm weakness, speech difficulties. Time to call emergency services immediately. Conclusion. A stroke is a medical emergency that requires prompt recognition and treatment. Understanding the different types of strokes, their risk factors, symptoms, and treatment options is essential for effective prevention and management. By adopting the healthy lifestyle and addressing risk factors, individuals can significantly reduce their chances of having a stroke and improve their overall health. If you or someone else experiences symptoms of a stroke, seek emergency medical attention immediately. Early intervention can lead to better outcomes and recovery.